Beta thalassemia is one type of inherited blood disorder where the body abnormally produces hemoglobin that is found in red blood cells that carry oxygen to all body cells. So, hemoglobin has two different chains which are alpha and beta chains. Beta thalassemia was called when someone had a low beta change. So now we know what is beta thalassemia. So what about etiology? So let's start. What actually happened during beta thalassemia? So first, thalassemia happens when there is mutation in globin genes. As for beta thalassemia, it is an inherited disease because of autosomal disorder. It affects the beta globin genes which have the wide genotypic and phenotypic variability of disease because there was a lot of beta globin. The mutation will lead to a reduction of beta globin change and affect the beta globin locus, which then impair the synthesis of beta globin where the anemia will occur. Usually, it is according to severity of beta thalassemia disease. So there was two types of beta thalassemia, which are beta thalassemia minor and major. As we know, there was an absence or lack of beta globin in beta thalassemia, so the excess unpaired alpha globin change aggregate to form precipitates will then damage red cell membranes. This will result in intravascular hemolysis. Meanwhile, premature destruction of erythroid precursor will result in intramedullary death and infective erythropoiesis.
Laboratory findings of beta thalassemia. There are several laboratory tests may be used to detect beta thalassemia. The first one is complete blood count. It is an evaluation of the cells in the blood. It determines the number of red blood cells present and how much hemoglobin is in them. It evaluates the size and shape of the red blood cells present, reported as the red cell indices. These include the mean corpuscular volume, MCV, a measurement of the size of the red blood cells. A low MCV is often the first indication of thalassemia. The second one is peripheral smear. In this test, a thin layer of blood that is treated with a special stain on a slide will be examined under a microscope. The number and type of white blood cells, red blood cells, and platelets are evaluated to see if they are normal and mature. With thalassemia, the red blood cells often appear smaller than normal, microcytic. The peripheral smear shows a nucleated red blood cell, poikilocytosis and hypochromic cell. The next test is hemoglobin electrophoresis. This test is to assess the type and relative amounts of hemoglobin present in red blood cells. Individuals with a beta thalassemia usually have larger percentages of hemoglobin F and hemoglobin A2. Now let us move to the treatment for beta thalassemia. Those with beta thalassemia usually require regular blood transfusions, as frequently as every few weeks. These transfusions help to maintain the hemoglobin at a high enough level to provide oxygen to the body and prevent growth abnormalities and organ damage. However, frequent transfusions can raise body iron to toxic levels, resulting in deposits of iron in the liver, heart, and other organs. Therefore, iron chelation therapy is used to remove the excess iron in the body. Other treatment may include the intake of folic acid supplement to help the development of red blood cells. Usually, this treatment is done in addition to other therapies. Last but not least, bone marrow transplant, or known as hematopoietic stem cell transplantation, can also be used for treatment of beta thalassemia.
In Surah Al-Baqarah verse 186, Allah said, "When my servants ask you, O Muhammad, concerning me, indeed I am near. I respond to the invocation of the supplicant when he calls upon me. So let them respond to me by obedience and believe in me that they might be rightly guided." Meanwhile, Allah also said in Surah Al-Hijr verse 55 and 56, they responded, "We give you good news in all truth, so do not be one of those who despair." He exclaimed, "Who would despair of the mercy of their Lord except the misguided?" Based on these verses, we could conclude that as Muslims, we should always rely on Allah and never give up on overcoming any difficulties in life, whoever we are, as patients or as the parents. Reliance on Allah and keep on praying for well-being and heal from the sickness are, without any doubt, the best form of help, other than keep encouraging each other to stay strong throughout the struggle. While as doctors, striving to give the best for the patients and determined to find the best treatment for them are the most important thing.